Good morning to all. I am Dr. Ajay, an ENT assistant professor working in a medical college in Chennai. And today we will discuss just a 10 minutes video about how to crack a audiometry image based MCQ in exams. And hope those who are writing exams, they will know that in the NEET-PG or in the AIIMS or in the whatever AJAY.M or whatever exam, if they try to ask an image based MCQ in ENT, there will be an image based MCQ on audiometry. This audiometry MCQ will be very easy to crack, so that even it will take just a fraction of second for you to answer in the exam. But most of us may make a silly mistake that will create you some negative marks in the exams. Okay, so for that, this 10 minutes video, hope it will help you before you appear in your AIIMS exam. Okay, so now without wasting much time, we will just go in depth about audiometry. So what is audiometry? Audiometry, as the name indicates, it is a one MCQ. What they will ask you is, so audiometry is a subjective investigation or a objective investigation. So audiometry is an investigation. Why it is done? It is done to find the type of hearing loss. There are four important. Say a patient comes to you. There is a patient who comes to ENT OP and he says that, doctor sir, I am having some decreased hearing. Okay, what are the things he will ask you? You check a tuning fork test and you say that okay, you have some hearing loss. Okay, the patient will again ask you, doctor sir, what is the problem I am having? That means what is the type of hearing loss I am having, whether it is conductive hearing loss or a sensor neural pattern of hearing loss or a mixed pattern of hearing loss. Okay, and then the next thing what he will ask you, doctor sir, how many percentage of hearing I have a defect? Okay, that is the degree of hearing loss. Okay, and one more thing, this is very important for your documentation purposes. Say when we are proceeding for a surgery, we want to document how much hearing loss the patient has. Okay, the third important use is for a documentation purpose, and then for our medico legal purpose. That is, say a patient, say there was last week there was one patient coming to me. He said that, doctor sir, after hit by police I got hearing loss when I was roaming outside during corona. Okay, so for this case he was planning to give a complaint against a police officer. Okay, so for that you want a medico legal aspect also. So when you document that the patient is having hearing loss, this will be a medico legal statement for him. Okay, so the purpose of audiometry, for doing audiometry, is to find out the type of hearing loss, to find out the degree of hearing loss, and for documentation prior to surgery or after the surgery, and for our medico legal purposes. Okay, so what is audiometry? They may ask you which of the, as I said you, audiometry is a subjective investigation. Again, which of the following is not a subjective investigation, or which of the following is not an objective investigation. Okay, so apart from audiometry and the tuning fork test, the rest all are the objective investigation. Subjective investigation is, subjective is what the patient says. Okay, subjective is what the patient says. Okay, so two subjective investigation, one is a tuning fork test and a audiometry, and the rest all like the impedance or the tuning fork test, the impedance or the OAE or the BERA or objective test and not the subjective test. Okay, so this is another important MCQ. The audiometry is a subjective investigation. Okay, so coming on to audiometry, what we are doing in audiometry. So we have said that we are finding out the type of hearing loss, we are finding out the degree of hearing loss, but what we are doing in audiometry? In audiometry, what we are doing is we are asking the, we are making the patient to sit in a soundproof audiometry room. Okay, and we are, what is the speech frequency of our hearing? The speech frequency is between 500 to 2000 Hertz is the speech frequency. Okay, but in audiometry we are assessing a frequency of around around 125 Hertz to 8000 Hertz. Okay, and another important MCQ for your AIIMS, there is another audiometry called as high frequency audiometry, which detects sounds of more than 8000 Hertz. That is from 8000 Hertz to 20,000 Hertz. Okay, and this high frequency audiometry is being done for which condition? Again an important MCQ, it is done for ototoxicity, that is a drug causing hearing loss. Okay. In a ototoxicity, the first thing will be a high frequency hearing loss, okay, so which is not detected by a routine audiometry. So in this case we use a high frequency audiometry. Okay. So what we are discussing, we were discussing about how are we doing a audiometry. So we are asking the patient to sit in a soundproof room, and we are giving him audio headphone kind of thing, and we are giving him, there are two types of audiometry. The most commonly used is pure tone audiometry. Pure tone is giving a click kind of sound, maybe a click or a beep kind of sound, or a speech audiometry. Speech audiometry is we are giving some certain speeches like a basketball, inlay, overlay, that is speech audiometry. Okay. Speech audiometry is the important MCQ for your exams is the pure tone audiometry. Okay. In the pure tone audiometry, as I said, we are making the patient to sit and giving him in a soundproof room and giving him some pure tone sounds from a frequency of around 125 hertz to around 4000 or 8000 hertz. Okay. And we are just increasing the sounds. Say if I am a normal person, or if you are a normal person, that means you will be able to hear the normal sound. So I am initially I will give him a sound of around 100 or 80 decibel. If the patient is able to hear, increase the sound to 70, increase the sound to 60. At one point of time, the patient will say that I am not able to hear that sound. Okay. Just mark that point. Okay. In each frequency, we need to mark that specific point at which the patient is not able to hear. Okay. That is the pure tone frequency what we are checking, and we are calculating the average of 500, 1000 and 2000 hertz to mark the pure tone average. That is the average hearing of the patient. So this is how we are recording the audiometry. In a nutshell, I will just go in the next page how we are calculating the type of hearing loss. Okay. So this is how we are doing audiometry, and this we are doing both for bone conduction and again another one for air conduction. Okay. So before going to how we are calculating the type of hearing loss, we need to know some WHO patterns of hearing loss. So WHO has given some patterns of hearing loss. Okay. So for that, what we want to know is what are the classification of hearing loss. So consider one thing you want to know, no need to memorize everything for your exams. Okay. So WHO pattern 0 to 25 decibel is considered as normal. So anything above 25 decibel is considered as abnormal. Okay. So this is what you want to know in the exams. Okay. And for your exams, this is enough. Okay. We are not going to go in depth like a mild or moderate, but I will explain that also. Say 0 to 25 is normal, 26 to 40 is mild, and 41 to 55 is moderate, and 56 to 70 is moderately severe. Okay. 71 to 90 is severe, 91 to 100 is profound, and 100 is total. This is the ASHA guidelines or the WHO guidelines for assessing the hearing loss. Okay. But in our exams, in our NEET exams or the AIIMS exams, they will give a picture and they will ask you what is the type of hearing loss, or else they may ask you whether it is normal or abnormal. They are not going to ask you whether what is the degree of hearing loss, like a profound or a total. Okay. First thing we want to know is whether the patient has a hearing loss or not. To know that, we want only one thing, 0 to 25, if the bone conduction and the air conduction are within 0 to 25 decibel range, it is normal. If it is more than 25 decibel range, it is abnormal. Just have this in your mind before you go to your exams. Okay. So coming on to the pictures or the images what they give in exams. Okay. So I will first draw a diagram and I will explain, then I will show you the images which in AIIMS they have already asked you. So say consider this. Okay. So consider this as a audiometry graph, and this is a 0, 10, 20, 30, maybe 100. Okay. and this is the frequency decibel 250, 500, 1K, 2K, 4K and 8K, whatever. Okay. So say I am just drawing two lines now. One will be a bone conduction, the other will be the air conduction. Consider this as a bone conduction and consider this as a air conduction. Okay. So now this is the audiometry curve which they have given in your exams. So whether it is normal or abnormal. So what we will think of, whether it is normal or abnormal. So the thing is, what we want to see, 0 to 25 decibel, 0 to 25 decibel is normal. Okay, 0 to 25, say this is the 25 decibel normal value marking curve. Okay, up to this it is normal, anything below this it is abnormal. So now in this graph, the bone conduction is in the normal range, the air conduction is in the normal range. That means the audiometry graph is normal, right. So when both bone conduction, air conduction both are in the normal range, it is normal. Okay. So now consider again, so I am just changing the graph now. Okay. Now say this is my first line, so let's change the color. So this is a bone conduction and this is a air conduction. Okay. Now in this graph, if they give a graph like this, now in this graph, what is the type of hearing, whether it is normal or conductive or sensor neural or mixed, how it can be. So here the bone conduction is in the normal range, the air conduction is in the abnormal range, that is it is something like a 40 decibel range. Okay. So when the bone conduction is in the normal, the air conduction is in the abnormal range, and if there is anything like a air bone gap, see between the bone conduction and the air conduction there is a gap, this is called as air bone gap, and if this air bone gap is more than 15 decibels, we need to think of conductive pattern of hearing loss. Okay. So in a conductive hearing loss, what happens, the air conduction will be in the abnormal, that means it will be affected, the bone conduction will be normal, and there will be air bone gap of at least 15 decibel and more. Okay. This indicates the pattern is a conductive pattern of hearing loss. Okay. So we have come across the normal pattern, the conductive pattern, and the next one we will, I am drawing a next diagram now. Okay. Say this is the first line which indicates the bone conduction, this is the second line which indicates the air conduction. So what happens in this audiometry now? In this audiometry, the bone conduction is in the abnormal range, that is below 25 decibels, the air conduction is again in the abnormal range. So both bone conduction, air conduction both are affected. Okay. And is there any air bone gap between these two lines? There is no air bone gap. Air bone gap is almost less than 1 or 2 decibels, that is normal. Okay. So there is no air bone gap. So no air bone gap, and both bone conduction, air conduction are affected, that indicates there is a sensory neural pattern of hearing loss. So three types: normal, conductive or sensor neural. If there is an air bone gap of more than 15 decibel, think of conductive pattern of hearing loss. If there is no air bone gap and both bone conduction and air conduction are affected, then it is a sensor neural pattern of hearing loss. Okay. So I will draw another one audiometry. Consider this as a same graph now. Okay. So here I am drawing the bone conduction of the patient. Okay. And here I am drawing the air conduction of the patient. So considering this around 50, 60, okay, this will be around 60. Okay. So here what is the type of hearing loss now? So here the bone conduction, whether it is normal or abnormal, it is abnormal, it is less, it is around 30 decibel range. Okay. Air conduction, whether it is normal or abnormal, again it is abnormal, it is something in the something around 60 decibel range. Okay. And one more thing, is there any airborne gap? Yes, there is a airborne gap between of around 30 to 60, around 30 decibels. So what is the type of hearing loss now? There is a airborne gap is there. What I said, airborne gap of more than 15 decibels indicates a conductive pattern of hearing loss. Okay, so will it be conductive? Again no, since bone conduction is also in the abnormal range, air conduction is also affected. That means there is a sensory neural pattern also. So if both conductive and sensory neural both are affected, then it is a mixed pattern of hearing loss. This is very rare for you to give in exams, but have it in mind. Usually very easy one is whether they will give a normal or a conductive or a sensory neural, but sometimes for twisting you they can give a mixed pattern in audiometry graph also. Okay, fine. So these are the 4 patterns of hearing loss. So now we have found out the types of hearing loss, how to find the type of hearing loss of the audiometry graph, and even we can find out the degree of hearing loss also, as I said, with the WHO guidelines. Okay, whether it is mild or moderately severe or profound or total. Okay, so coming on to specific patterns in audiometry. Okay, I am just rubbing it again. So coming on to specific patterns in audiometry, so considering this as a normal value. Okay, so again here I am drawing 2 lines. This is a bone conduction, this is a air conduction. Okay, but in this graph, this is a bone conduction, but here, okay, so what is the type of hearing loss now? What is the type of hearing loss? The hearing loss here the bone conduction is normal, the air conduction is affected. That indicates there is a conductive pattern of hearing loss. But what is the specific thing with this audiometry? Specific thing is there is a dip in bone conduction at 2000 Hertz. Okay, this dip in bone conduction at 2000 Hertz is called as Kerr-Hart's notch in audiometry. Kerr-Hart's notch. Kerr-Hart's notch is seen in one condition, that is otosclerosis. A very important image based MCQ. They may give a picture like this and ask you what is a diagnosis. Okay, that will be a conductive pattern with a dip in bone conduction at 2000 Hertz. Okay, or they may give a differential diagnosis also. What cannot be a diagnosis in this kind? Okay, and what is the notch? This can be a MCQ also. And the Kerr-Hart's notch is a dip in bone conduction at 2000 Hertz. Okay, if there is a dip in bone conduction at 2000 Hertz, it is Kerr-Hart's notch. So Kerr-Hart's notch is usually seen in diagnosis of otosclerosis. Okay, so I am going on to the next one. So here again I am drawing a diagram. So consider this as a bone conduction. Just a minute. So consider this as a bone conduction, this as a air conduction, bone conduction, air conduction. So what is a typical, whether it is normal or abnormal? So both bone conduction, air conduction, both are in the normal range. So it should be normal. But what happens here? There is a dip in the audiometry at 4000 Hertz. Okay, a dip in audiometry at 4000 Hertz. This occurs in a condition called as noise induced hearing loss. Noise induced hearing loss, there will be a dip in bone conduction at 4000 Hertz, and this dip is called as acoustic dip or a boiler maker's notch. Say in boiler making industries, okay, there will be huge sound, the employees will be exposed to huge sound. Okay, so typically their hearing will be normal, but on prolonged exposure of this noise sounds, okay, the patient will have on an examination they will have a dip in audiometry, dip in conduction at 4000 Hertz. That indicates a noise induced hearing loss. A very important image based MCQ also. that is for laborers law also, it is very important. That condition is called as acoustic dip or boilers makers notch. Okay. So, coming on to the next one important slides before going to the questions I will ask you. So, consider this as a audiometry. Okay. So, this audiometry, it could be something like a U shape. So, this occurs in which condition? Okay, this is called as trough shaped or a basin shaped or a U shaped audiometry seen in congenital sensorineural hearing loss, that is a child born with hearing loss. Okay, then on exam on audiometry pattern, it will be something like a trough shaped or a basin shaped or something like a U shaped audiometry seen in congenital child born with sensorineural hearing loss. Okay, and okay, and one more thing before going to questions, and one more thing I will just point out. So, if there is something like a image based question, like if they ask for a diagnosis kind of thing, say if the audiometry curve is like this, say this is the bone conduction, this is the air conduction. Okay, what it indicates, what this one is indicating, in the low frequency it is normal, but in the high frequency it is abnormal, right? Low frequency normal, high frequency abnormal. This indicates a high frequency sloping sensorineural hearing loss, right? How it is? There is no airborne gap, only some 5 to 10 decibel, that indicates a sensorineural hearing loss. This occurs in a condition of presbyacusis, that is a old age hearing loss, presbyacusis. Okay. So, these are the important patterns with the audiometry is concerned. And one more thing, there is one more pattern which is called as low frequency sensorineural hearing loss, that is there will be sensorineural hearing loss in this low frequency, but in high frequency it will turn into normal, or it could be something like a flattening kind of curve. This is usually seen in early stage of Meniere's disease. Okay. So, in a classical nutshell, for diagnosis purpose, we have two things: a Carhart's notch, dip in bone conduction at 2000 Hertz is Carhart's notch seen in otosclerosis, and dip in conduction at 4000 Hertz is seen in noise induced hearing loss, and high frequency sensorineural hearing loss sloping pattern is seen in presbyacusis. Low frequency sensorineural hearing loss seen in early stage of Meniere's. Okay. So, these are the important audiometry, and trough shaped audiometry is seen in or sometimes is seen in congenital sensorineural pattern of hearing loss. Okay. So, I will just discuss some questions with it. Okay. So, whether it is normal or abnormal, 0 to 25 decibel, this is the normal WHO marking. So, this is bone conduction, this is air conduction. So, that indicates both are in the normal range, and this graph is a normal. Okay. So, consider this is the image based MCQ given in your AIIMS exam. Okay. So, which of the following can be the type of hearing loss? Okay, whether it is normal or conductive or a mixed or sensorineural. Here, this is the bone conduction, this is the air conduction. The bone conduction, whether it is normal or abnormal, it is normal. Air conduction, normal or abnormal, it is abnormal. That is, it is in the hearing loss range, maybe a mild pattern of hearing loss range, and there is a air bone gap is present. Okay. So, air bone gap of more than 15 or 20 decibel indicates a conductive hearing loss. These are all the graphs what we discussed till now. Okay. And here, what is the type of hearing loss now? This is the normal range. This is the bone conduction, this is the air conduction. Okay. Here both bone conduction, air conduction, both are in the abnormal range. That indicates this is a sensorineural pattern of hearing loss. Right, clear? Okay. So, here what is the type of hearing loss in this right here? So, here this is the normal one, 25 decibel is the normal one, The bone conduction is in the abnormal range, it's something around 40, air conduction something around 60 decibels, and there is a air bone gap of around 20 decibels between these two lines. Since bone conduction, air conduction both are affected, it is a sensor neural, and there is a air bone gap. This one is called as a mixed pattern hearing loss. Okay, very easiest MCQ to crack in exam, but because of our lack of concentration in the exams, we may miss it easily. Okay, very easy to crack. Say which of the following could be diagnosis in this condition. Diagnosis. So when we check the audiometry pattern, here the bone conduction 0 to 10 decibel, it is normal. The air conduction 60 decibel, that is, it is abnormal, right? And here what I could see some gap between the air conduction and bone conduction, right? So this indicates a conductive pattern of hearing loss. But one more diagnosing, I am asking the diagnosis in the exam. So here there is a dip in bone conduction, dip in this bone conduction at which hertz? 2000 hertz. This indicates a Kerr-Hertz notch in audiometry, Kerr-Hertz notch. So seen in which condition? Otosclerosis. Right, a very important image based MCQ, otosclerosis. So here the next one, they are giving a audiometry curve like this, and they are asking you to give some explanation for this. Okay, so here when I could see a dip in this audiometry at 4000 hertz in both right and left. That means if it is a 4000 hertz, it indicates a acoustic dip or a Boilermaker's notch seen in noise induced hearing loss. Clear? Any doubts with this? Okay. So the next one, what I said, this is called as a U-shaped or a trough shaped or a basin shaped audiometry seen in congenital sensory neural pattern of hearing loss. Okay. So these are the various image based MCQ which they can give you for exam. And when you just see, this even takes just a fraction of second for you to answer. But you can read the question also, they may give you some history. Nowadays they are giving a clinical history, the NEET is going to turn into next now. So they are going to give you some clinical history. And the clinical history, even if you have doubt with the audiometry graph, just read the history. With the history you can find out whether it is a conductive or sensor neural. With that you can just answer what could be the diagnosis. Okay. So hope this will be very helpful for your AIIMS pattern exam, and audiometry, as I said, it's very easy to crack also. Thank you.